Hey everyone, Brian from MedigaplList.com. Real quick, click on the link below in the description, MedigaplList.com, to get more information on top of this video. Anyhow, today's video is going to be about avoiding the donut hole for Medicare Part D. This is kind of tricky. You know, Medicare Part D actually, with the donut hole, excuse me, I gotta get a piece of paper. With the donut hole in 2012, the coverage gap, or AKA donut hole, was when you hit $2,840, I think it was, for retail cost of your drugs. That means, you know, if you were taking a brand drug and it was expensive, you know, and it cost $300 for the retail cost. When that reaches, you know, over $2,800, then you're going to go into the coverage gap, or the donut hole, aka the donut hole. In 2013, it was $2,970 for the retail price of the cost of your drugs. And what happens when you go into that, and you know, when you're looking over your drugs, and actually, you know, I always say this is this is really important. You should have a broker. Unless you really know how to do it, you should have a broker running your drugs and finding the best plan for you, and looking at the bar charts that they have, and the out-of-pocket costs and so forth, and comparing them. In 2013, you would pay 47.5% of the cost when you hit the coverage gap. I mean, it's a lot. You know, brand drugs is what really hurts you within the, you know, the donut hole, or actually before, you know, when you first start paying for the drugs, because, you know, those are what the retail costs are high. The other, you know, when you're on generics, number one, the retail costs are low, and number two, who said that you had to buy the generics on your prescription drug card? You know, you could actually just, you know, purchase the generics. A lot of times, if they're on that generic list, you could just go to wherever you get your prescription drugs from, and just, you know, buy them cash for, you know, $4, $6, whatever they may be. You know, a lot of people are on statin drugs. Some people cannot get on the generics, but if you can, you know, it's an easy way to get away from the donut hole. The good thing about it is what they're trying to do is lower the cost to the consumer for the coverage gap each year. We'll see how that goes, you know, specifically with the brand drugs, because, you know, this is how the research happens for drugs. I mean, I think, you know, people know, drugs are expensive, but without that cost, especially for the brand drugs, how are the companies going to afford to do research? Now, maybe they're a little bit too expensive, but, you know, it is what it is. So, avoiding the donut hole, the biggest thing is to, you know, make sure you can get on those generics. Also, contact, you know, ask your doctor if he has, a lot of people I've spoken with are getting samples from their doctor, if they can get put on generics. Also, you can call the company and say, hey, look, you know, I can't afford the drug that you have, but, you know, can you help me out? You know, see what we can do. A lot of times they'll help you either with the cost, or, you know, sometimes they'll send you free samples if they want to, I guess. So, like I said, I mean, the coverage gap is they're lowering it. They're not lowering the retail cost. But they're raising the retail cost each year of what what the limit is. So, for instance, you know, when it was $2,800 last year, it's $2,900 and some change this year. Hopefully, they'll raise it again, so it's over $3,000 what the retail cost. Because with inflation, of course, everything else goes up. So hopefully, they can raise that so you don't get stuck in the donut hole too quickly. And then also, you know, the payment that, you know, 47.5% is what you owe now, but hopefully that will go down to, you know, 25% and then 10%, and eventually they'll get rid of the coverage gap, because it is a little ridiculous, especially for people that that need their drugs and can't do anything about it. I hope this helped. Please check out the website, MedicaPlus.com. We have more information on there, and I'll see you at the next video.